Good morning and welcome to Controversies of Cancer Epidemiology. I am Alexis Bergman, and today we are going to be discussing the effects of regular aspirin use on risk for cancer. In a study published by the Journal of the American Medical Association, researchers used two large prospective cohort studies, the Nurses' Health Study and the Health Professionals Follow-Up Study, to look at whether or not regular aspirin use has an effect on risk for cancer. The Nurses' Health Study includes women, and the Health Professional Study included men. The potential limitations of this population include that there were twice as many women as there were men, which could skew the results if aspirin affects women differently than men. This also only includes people involved in the healthcare field, so if there are lifestyle choices associated with being in the healthcare field, this could contribute to confounding variables. The measured exposure for the study was aspirin use, which was self-reported every 2 years for 32 years. The participants were then grouped into regular users who used aspirin 2 or more times per week, or non-regular users who used aspirin less than 2 times per week. The doses in milligrams of aspirin were also calculated. And the potential limitations to this exposure include that since it was self-reported, it is subject to recall bias. However, this was reduced by having them report use every 2 years. The measured outcomes for the study were relative risks for overall cancer, as well as some individual cancers, as well as population attributable risk. The limitation with relative risk of overall cancers is that it is a broad statistic that includes many different types of cancer, so it is not specific. And population attributable risk is difficult in this case since we are only dealing with healthcare workers, so extrapolating the results from this study to the whole population could be inaccurate. The results of the study show that compared with non-regular use of aspirin, regular use resulted in a 3% decrease in overall cancer risk. This was mainly due to a 15% decrease in gastrointestinal cancers, including a 19% decrease in colorectal cancer. There was no association between regular aspirin use and breast cancer, advanced prostate cancer, or lung cancer. There was also a dose-dependent and duration-dependent relationship found where most benefit was seen in those who took 0.5 to 1.5 standard aspirin tablets for more than 10 years per week, for more than 10 years. Aspirin use also decreased the risk in those who had undergone screening for colorectal cancer, as well as those who had not undergone screening for colorectal cancer. The strengths of the study include that it had a large sample size, which is good for statistical accuracy. It's also a prospective study, which reduces the room for bias. There was also long-term follow-up of 32 years, which gives lots of data points, as well as the fact that it had never been done before. The findings align with previous studies' findings about aspirin use in cancer, which supports the credibility of the study. There's also good discussion of the biological mechanisms that would underlie aspirin's effect on cancer risk. There's also thorough statistical analysis done, and they apply the findings to the context of screening, which makes the findings more applicable to the real world. The limitations of the study include that, as mentioned before, this is a population of healthcare professionals, so there may be issues when trying to apply the findings to the general population. The findings are also not generalizable to breast cancer, advanced prostate cancer, or lung cancer, since there was no association found among those cancers. With that being said, I think there is a need to distinguish this fact when talking about overall cancer risk, because overall implies all cancer, even though it actually does not. There's also a lack of discussion on the potential negative side effects of taking aspirin weekly. for the long term. And they do state that they adjusted for potential confounding variables, but they do not detail what those confounding variables are in the discussion. This study is also written about in the New York Times as an 8-sentence wellness report. The author does mention that there was no impact on risk for the several types of cancer that were mentioned in the study, and it does state that the specific benefits of colorectal cancer and gastrointestinal cancers exist. However, it does not discuss the fact that the colorectal cancer and gastrointestinal cancer reduction risk is the primary reason for reduction in overall cancer risk. It's also missing important information about the study design and the population. The post does not overstate the findings, but it does miss important details that influence these findings. As we learn every week, you have to be careful what you believe and investigate what you read. That's all for me this week. Bye!